Women carry miscarriage with a lot of shame, a lot of guilt, a lot of stigma. But you know what? Let's have a conversation. Before we have any conversation, I want you to understand the word miscarriage and abortion. Both terms are used with the intention of ending a pregnancy. Both terms refers to the end of pregnancy. But the key difference here is whether the ending of pregnancy was intentional or it was not intentional. Miscarriage is also called spontaneous abortion, and it is an intentional loss of pregnancy, usually happen below 20 weeks. The causes, we will look into them. Most people, when they go through, most women, when they go through miscarriage, they feel guilt, they feel shame, they feel stigma, but we are going to look at that. Abortion, in the other hand, is ending of pregnancy, intentional ending of pregnancy. Intentional ending of pregnancy done with medication or surgical, or maybe traditional forms of those medications may be chosen by the person himself, may be chosen by a person herself, or medical, or the doctor might advise you to go through it. Also, we have other reasons where someone can choose to do abortion: financial reasons, emotional readiness, among other things. Yeah, physical readiness, among other things. Legal access of abortion varies depending on different countries. Some countries abortion is allowed, some countries abortion is not allowed. But I'm telling you what I know. We are going to reach at a point where people will be, someone will have a pregnancy, or someone will give birth to a child when they want. If they don't want, they will be doing abortion. The country is approaching to that level where the abortion will be legal. So let's have a small conversation about this thing called miscarriage. So we have said miscarriage happen below 20 weeks of pregnancy. It usually happen because the fetus cannot develop normally. And most miscarriages usually happen in the first trimester. Yeah, in the first trimester, especially before 13th week of pregnancy. The common signs of miscarriage is vaginal bleeding, cramping or abdominal pain, also passing of clots and tissues of blood. Yeah. Also, you can have sudden decrease of pregnancy. We have types of miscarriage. No, we have types of abortion. I'm talking about miscarriage right now. So, common causes of miscarriage could be maybe chromosomal abnormality, yeah, hormonal imbalance can cause miscarriage, cervical or uterine problem, infection is also another common cause, chronic illness such as diabetes, thyroid conditions, also lifestyle factors. Those who are smoking, those who are taking a lot of alcohol, when they are pregnant, they can experience a miscarriage. Okay, I want to say that women carry miscarriage with a lot of shame. Yeah, women carry miscarriage with a lot of shame. It is not your fault as a woman. Most miscarriages are beyond someone's control, and it is not caused by stress or exercise or sex, or yeah. You find that when a woman goes through miscarriage, then most miscarriages are intentional. remember we said miscarriage and abortion, both of them are, the goal is to end pregnancy, but what make it or what make them different is one of them is intentional. So miscarriage is not intentional, and sometimes we have said it is beyond your control. It is beyond your control. You cannot do anything about it. You find that after miscarriage, the body usually returns to its normal the body returns to its normal state within few weeks, and after miscarriage most women can successfully conceive and even give birth to a very beautiful baby. So most miscarriages go on, let me say, most people have successful miscarriage and they can later become pregnant. Okay, let us look at some of the reasons why a woman will feel shame, a woman will experience shame, will experience guilt, will experience silence after a miscarriage, even though it is a common and natural part of reproductive health. So long as you are a woman, sometimes you can experience miscarriage, and it is common and it is natural part of a reproductive health. And these reactions is often shaped, this guilt, shame and what, they've been shaped by social, cultural and personal factors. Yeah, those things, you find that some women feel shame after miscarriage because of stigma and silence. The society often treats miscarriage as something to hide or not to talk about, which make it feel isolating it. Some women also feel the shame, the guilt because of their feeling as like it is a failure. Some women blame themselves or feel like their body failed them. Miscarriage, you have said, it is beyond your control. Also, another thing that women go through is that the pressure to be strong. You are just vulnerable human being. Just move on, grieve openly, don't feel guilty, don't feel shame. You are not strong, you are not strong. You are going through a loss. Just grieve. No, take your time to grieve as long as you can. Another thing is about the culture and the religion belief. These cultures and the religion belief add an extra weight to the laws, and sometimes they make a woman believe that getting miscarriage is a spiritual thing. Yeah, it is a taboo. You did something wrong, that is why you are getting miscarriage. Maybe you it is a curse. These beliefs, yeah. Also, what make women also go through silent grief, stigma after miscarriage is about lack of knowledge, lack of awareness. Yeah, if they could be aware of some of the miscarriage are beyond your control and you cannot do anything about it. Now they won't put themselves into that state. Yeah, they won't put themselves into that state. My last advice: after miscarriage, you are vulnerable, you are not strong, you are allowed to grieve as long as you can. Talk about it, ask for help, ask for support. Some of those miscarriages you cannot do anything about them. They are caused by maybe medical condition, they were caused by maybe infection, hormonal imbalance, and maybe you did not know. So you cannot do anything about it. Just try to be strong. And the good thing about miscarriage, most women after miscarriage they can conceive and give birth normally.